talked to Catherine Connolly, Cúig agus an talked to Ronnie Harkin Cúig.
Gur mágad a cahirirlí agus chum fáilte raibh an mBille seo. Is so gur a bé an mBille is sciire a tháinig os má cór agus os cór na dála I ma amsa a réanos nílí geisteach leathnach go bháin agus an rud atá I gceist ag an rialtas ná deara a chur le tálaí dá chur chónaí I ngá ospidéal agus chum fáilte raibh an gcinne sin agus is deiscéal amachchas a maithe. Minister, I stand here for my 5 minutes and I want to welcome this bill. It's the shortest bill that has come before us, I think, in my time, and I welcome it, and it's very positive, and it's putting an end to in-service charges, which is 80 per night, up to a maximum of 800, and I'm delighted with that. It's amending the 1970 bill and the regulations made thereunder, and it's 53 years after the bill, so I welcome that. I don't welcome the fact that we have still left in place the accident and emergency charges, and I don't understand the logic that if we took away the charges that the accident and emergency would be overwhelmed. I think most people are reasonable and rational. A few weeks ago in my own case and my partner, we tried to avoid the hospital as best we could, and most reasonable people do that. And I don't agree with that logic, and I don't think there should be a charge for that. It's taken a very long time, and Deputy Roisin Shorthill has made this, and Sláinte here, all parties came together because at every election, that's the biggest issue: health, housing, public transport, neutrality and so on, hospital top of the list, and public services. And so that's why Sláinte Care came into existence, and that's why there was a report. The implementation of that has been tardy, and I refer to the Bill's Digest, and I want to thank them once again for the work they do under pressure. And they pointed out that a review showed of Sláinte Care and its implementation showed there was some progress, but slow progress in relation to taking away the barriers for access. So finally we are doing that now, and I welcome that. I have a question in relation to, and I welcome, Minister, the positive things that you've outlined in your speech, and I pay tribute to you for doing that, and also in relation to the public contract for consultants. I wish you the best of luck on that. In relation to this issue and hospitals, the Digest brought it to my attention again, and we're all aware of this. The position remains that patients who opt to be treated as private patients in public hospitals are subject to a charging regime set out in the schedules from the original Act, I presume, and whether they were amended. Now, and indeed, when I went in with my husband, the first question we were asked, have you private health insurance? Now, I'm not sure why that's relevant at all in a public hospital. Is it a throwback? Is it a legacy? Why are patients being asked to have they private health insurance? Because I presume that there's no difference in treatment between public and private patients in a hospital. Yeah, well, maybe you could clarify that. What is the difference, and how can we possibly stand over treating a public and a private patient differently in a public hospital fully funded by the taxpayer? How can that be stood over? What is the logic to it? Except for an income for a public hospital that's really, really in trouble. Now, I'm very familiar with Galway Hospital. I've continuously paid tribute to the staff who work under pressure, but it's a hospital at Creaking Point. Just to give you a little flavour, and if I have a chance tomorrow, I might return to this. 2014, Minister for Health, Varadkar, now current Prime Minister, or Taoiseach, he said, a new building was the only solution to the problems in UHD. 2015, and Kenny said the ED was not fit for purpose. That's 2015. We still don't have a new ED in Galway. 2016 programme for government with a view to funding being provided, didn't happen. The actual ED itself has just progressed one little bit, and that's up to, what is it called, an SAR, a strategic assessment, is it? That's where we're at with that, even though this is now 2023. And what I want to get out, and I'll go return it to tomorrow, is I'm not sure what happened to the concept of a brand new hospital up in Merlin Park on 150 acres. I'm not sure how that became an elective hospital while the congested site continues to be expanded out of all proportion. And I'll come back to that tomorrow, and you might just come back to me in relation to why a patient would be treated differently in the public hospital, and I'll stop for my colleague.